So we're going to start into tetracycline and the sulfa drugs. And when I usually give this talk, we all want to be here, but things look like this. This year, I think it's the opposite. I think we aren't getting the snow. Um, we're getting more of the sunshine, but we're not on a beach. So anyway, just have a couple more weeks to go here. So tetracyclines. Tetracyclines are a very commonly used group of antimicrobials in veterinary medicine. And they are a bacteriostatic group. So they act on ribosomes and protein synthesis, but they do so in a way that they don't immediately kill the bacteria. It just suppresses growth in the bacteria. So we use these a lot in food animals, but we do also have some small animal use for them. These drugs tend to have this cyclin suffix, so cyclin is at the end of the word in the non-proprietary names. The spectrum of these drugs are gram-positive, gram-negative, and aerobic bacteria. And there are some exceptions within there, but that's kind of the general spectrum. So they're considered to have a broad spectrum of activity. So, little review question. Could we use these with penicillins and cephalosporins? If you remember back to talking about them at the very beginning, they need to have a growing population of bacteria. So if we add a bacteriostatic type drug to the protocol, and the reason why we would do it is we might want more of this gram-negative activity than the penicillins or cephalosporins have. And so if we did that, though, we're going to suppress the growth with the tetracyclines, and that's going to interfere with the action of penicillins and cephalosporins, which is to interfere with the construction of the cell wall. So the bacteria have to be rapidly dividing in order for penicillin and cephalosporins to act. So we don't want to put them together, give them together with tetracyclines. Tetracyclines have the ability to get into cells and go after intracellular organisms. Many of these are rickettsial diseases, and rickettsial diseases are transmitted via ticks. So the ones that are here listed here are Rocky Mountain spotted fever, Potomac horse fever, Lyme disease. All three of these are tick-borne diseases. And then also Mycoplasma pneumonia is also intracellular, as is our chlamydial infections. Chlamydial infections are pretty typical in birds and cats. And then lastly, Wolbachia. If you recall from your parasitology class, Wolbachia is a bacteria that has a commensal relationship with the heartworms. And we think it contributes to the lung and renal disease portions of heartworm disease. And there has been shown to be enough of a support of heartworms with Wolbachia present that eliminating them with the use of doxycycline will help to get rid of heartworm disease. It's standard part of the protocol now for treating heartworm disease. So we can divide tetracyclines into two groups, and the first group is tetracycline. This is a drug name, in this case, within the group of tetracyclines. So tetracycline and oxytetracycline are similar. They are hydrophilic, and they aren't used as much as they once were because the new drugs, doxycycline and minocycline, are lipophilic. That means they can go into a lot of different tissues. They have a longer half-life. They are human drugs that we use in animals, but they have just been shown to be superior to the older tetracyclines. So, and then doxycycline is the preferred treatment for Lyme disease in humans, and we also use it in animals. So tetracyclines vary in their absorption, especially gastrointestinal tract. For tetracycline and oxytetracycline, the hydrophilic ones, they are chelated, so they combine with mineral cations. And these mineral cations are calcium, magnesium, iron, and copper, and you can see they have charges on them. So these cations, cations just means positively charged ions, they combine with them and they're not going to be useful. So we don't want to give the older tetracyclines, tetracycline and oxytetracycline, with dairy products or antacids. The antacids are going to change, especially the antacids that are have these cations in them. So things like Rolaids, Tums, um, Mylanta, those kinds of drugs. They will chelate and take out these drugs. You just also don't, this is not the drug that you want to put in some cheese. That's not how you want to give it. So you want to be careful that owners know that because of the calcium in the cheese. Doxycycline is affected less, so we don't worry about it quite as much as we do with tetracycline and oxytetracycline. Oxytetracycline is given IM. It is not absorbed well orally, so it is an injectable. And there is a long-acting form of it called LA, that is for long-acting, 200. It lasts 2 to 3 days and has been used a lot in livestock for that reason, that you only have to repeat the injection every couple of days. With tetracycline, the oral form is the most reliable form of that drug. As I said, the tetracyclines, as in tetracycline and oxytetracycline, are hydrophilic, so they will get into many tissues, into saliva, into bronchial secretions, but they don't cross the blood-brain barrier. So doxy and minocycline are lipophilic. They cross the blood-brain barrier. They get into the globe of the eye and into the prostate. For excretion, oxy and tetracycline, the renal excretion is more important in them. But with doxy and minocycline, they go into the intestine. They are excreted through the liver and go into the intestine, and they recirculate, so they last longer. That's why they have that longer half-life. And that is due to the concept that we learned way back in chapter 3, enterohepatic circulation. If you remember, they're excreted into the GI tract and then they're reabsorbed, go back through the liver, and some goes into the systemic circulation, and so they appear to last a long time simply because they're recirculating in that way. Because oxy and tetracycline are rely on renal excretion, we need to be careful of them in animals that have compromised kidneys. We don't worry about that really with doxy and minocycline. So one big thing, here's a precaution, and that is the use of tetracycline and oxytetracycline in animals that are going through the development of their teeth and bones. And so that can be animals in the range of 4 to 16 weeks of age, or less than 4 to 16 weeks of age, I should say, depending on the animal. Those are the typical ones, weeks of age of developing teeth and bones. And so the larger animals, we're going to be leaning toward the 16 weeks, and the smaller ones, we're going to be leaning towards less than 4 weeks. What happens is that they combine with the calcium in the teeth and bones, and they can cause abnormal growth, and they cause this yellowing of the teeth. It makes the teeth look very unattractive and like something's going wrong with them. They can cause the teeth to kind of be more brittle than they would normally do, and they can also interfere with bone growth. So we need to be careful in giving these in pregnant animals because um, in the last half of gestation, that's when we start to get fetal bone growth. This is less likely with doxycycline, so we don't worry about it quite as much with that, and we can give doxycycline to a younger animal and not worry about it like we would with tetracycline and oxytetracycline. Because tetracyclines are um, broad spectrum, we can get super infections when it's administered orally. What that means is we get an overgrowth of a particular type of bacteria. This can lead to diarrhea in animals and can adversely affect ruminants and cats to some degree as well. So with dogs, what we'll see sometimes just as adverse effect and not in the super infection form is vomiting, anorexia, and diarrhea, that they may not tolerate oral administration so well. And so that's always the thing that you want to ask on a callback is, and usually owners will call you if the animal starts vomiting, but um, you want to have them watch for diarrhea as well. With cats, they can be less tolerant than dogs. They actually will get fever, sometimes become depressed and get abdominal pain. We can give doxycycline with food, and that can help sometimes with decreasing the adverse effects. And then ruminants, oral administration, we can sometimes get ruminal stasis. So that's why the injectable is more favored for ruminants. Cats have a special situation with doxycycline. We've learned this, unfortunately, the hard way. When a tablet, sometimes we're giving half of a tablet and, or a powdered form of doxycycline, and it has actually irritated the esophagus as it goes down and kind of stuck there. And we can get what are called esophageal strictures, where the esophagus narrows down because it's been irritated and then it sort of closes more in. And that's not a good thing. That can cause a lot of other problems with food getting down and that kind of stuff. So we always give with a few milliliters of water. We chase that pill tablet down with just a few mils of water, and we need to give owners a little syringe to help them with that particular thing. So big side effect that we've been finding with cats and doxycycline. Doesn't seem to happen in dogs. We do need to be careful with IV administration of these drugs. In horses, we do not give IV tetracyclines. It can cause arrhythmias and collapse and death. If we give them rapidly IV in other species, we can get some of the same effects. We can get low heart rate, low blood pressure, but horses seem to be very susceptible to arrhythmias. So I would caution anybody giving them IV. And with cattle, we have a long withdrawal time, so we need to tell producers about that when we're giving these drugs to them. In the past, it was found that expired tetracycline and oxytetracycline could decompose to a nephrotoxic compound. There are more recent formulations that do not seem to cause this, but if you hear that, it's because in the past the formulations were not good. We don't tend to worry about it as much with the way that it is currently synthesized. So here are some questions, and I'm going to ask you a question about tetracyclines.